Dear future parents, if you are waiting for a baby, we invite you to donate the cord blood. What is cord blood? When the baby has been delivered, after the umbilical cord has been cut, some blood remains in the cord vessels, that is generally considered as a waste product. Why collect it and use it? This blood is rich in hematopoietic stem cells, which may be used for transplants in patients with leukemia or other serious blood diseases. How is it used? Stem cells of the cord blood are used in a transplant to replace the diseased cells and reconstruct a new hematopoietic system in the patient. Thousands of transplants have been carried out successfully, especially in children and teenagers. The stem cells of the umbilical cord are used in transplants as an alternative source to the usual bone marrow donation. What is the cord blood bank? The cord blood bank stores for many years the stem cells collected from donation by mothers who have voluntarily and freely donated their cord blood for all patients who need a transplant. How is the cord blood donated? Any future mother may ask to donate her cord blood, which is easily collected by the obstetrician after delivery of the baby. The procedure in no way changes the assistance given to their mother and baby. The mother who wishes to donate her cord blood must have blood tested carried out free of charge after the delivery and 6 months after, to exclude the presence of diseases that could be transmitted to the patient. Donation of cord blood is voluntary, anonymous, and free. Donation of the cord blood is impossible if the baby is born prematurely, the mother has taken certain kinds of drugs, the parents could transmit infection or genetic diseases. The importance of the donation of a foreign mother. Patients coming from foreign countries who need a transplant currently find no donations. The basic genetic characteristics for compatibility and consequently a successful transplant are different for each population. To this fact should be added the total absence of storage banks in almost all the countries of origin. That is why it is important for new donor mothers to be registered. Their donation could be used in transplants for patients from their same country, who will thus be able to find a genetically compatible donation in the banks. The dedicated donation. If you already have a child or blood relation in your family suffering from leukemia or other diseases that can be cured with stem cells, you may ask for the cord blood to be collected and stored for a possible future transplant. To obtain more information about this, speak to your doctor, the obstetrician, those in charge of the bank, or the appropriate association. Main criteria of exclusion: permanent or temporary. Taking of drugs and chronic alcoholism. Casual sexual intercourse with risk of transmission of infection diseases. Sexual intercourses with unknown persons. Sexual intercourse with HIV, HBV, HCV infected persons or at risk of infection. Hepatitis, sexually transmitted diseases, positive test for syphilis, AIDS, hepatitis B and C. If you don't have these main criteria of exclusion, you can make the donation of cord blood. You need first to answer a questionnaire and then sign an informed consent. For more information, ask your obstetrician or the nearest cord blood bank.